Hello, I'd like to talk about the new global health sector strategy for preventing and managing sexually transmitted infections that has been approved by WHO's World Health Assembly. This strategic plan has 5 main pillars that we feel need to be addressed in order to prevent and ultimately reduce the global epidemics of sexually transmitted infections. This is important because every day 1 million people globally are infected with a new sexually transmitted infection. So over 370 million people every year acquire a sexually transmitted infection. The burden of these infections is tremendous, not only causing severe morbidities and difficulties for people, but also in some cases it can lead to death, particularly of newborns and of older children as well. There are 5 pillars in our strategy. The first one is to make sure that we have sufficient information about the epidemics. Who is infected, where do they live, and what are the characteristics that for the populations most likely to be infected with the different diseases. Secondly, we have a pillar that addresses the need for innovation. As you heard me say, that with the number of infections that we have, clearly we need to accelerate actions to better address these. And so the second pillar focuses on finding new ways of preventing and treating sexually transmitted infections. Thirdly, and has been emphasized by our new Director General at WHO, the important aspect of achieving universal health coverage for everyone is absolutely central to this strategy. To achieve universal health coverage, we need to address 3 further pillars in our strategy. The first one is to make sure that we reach everyone that's affected by these infections. We need particularly to pay attention to reaching those who are most at risk, who are most vulnerable, most marginalized, and so to ensure that there is an equitable approach to the strategy. Secondly, we need to make sure that we use effective interventions to address the various epidemics of sexually transmitted infections. From the evidence that we have at the moment, we've identified at WHO 3 priority interventions, which we know from data are very cost effective and are likely to lead to rapid changes and reductions in sexually transmitted infections. The first one of these is to reduce and ultimately eliminate the transmission of syphilis and HIV from mother to baby during pregnancy and delivery and immediately afterwards. These strategies have proven very effective when they're implemented through providing treatment to women during pregnancy, and in fact several countries now have managed to completely eliminate this mode of transmission of syphilis. Secondly, we need to address the issue of gonorrhea. Gonorrhea is a very widespread sexually transmitted infection, and it's often associated later in life with infertility. So it's a dangerous STI, but it's very widespread. And the big problem is that the drugs that we have to treat it are increasingly becoming resistant, and so together with the global antimicrobial resistance programs, we're trying to find ways of developing new drugs and new treatments so that we can better prevent and treat gonorrhea. The third intervention is around HPV, human papilloma virus. This virus is transmitted sexually, and it later in life causes cervical cancer among women. And so by controlling this infection, we will be able to ultimately eliminate cervical cancer through sexually transmitted infections. Those are our 3 main interventions. And then the final pillar for achieving universal health coverage is financing. Financing for addressing sexually transmitted infections has been a major weakness. Many governments are reluctant to invest in the types of strategies that I've talked about, and so we need to have a big push to make sure that everyone in decision-making positions is fully aware of the burdens and the impact of sexually transmitted infections, so that they can find ways of getting the financing together and ensuring that this financing stays in place long enough to reduce and ultimately eliminate these global epidemics. So thank you very much.